Good morning. So as Chris said, I am Senior Vice President at Nemours Children's Health System. We are an integrated child health system. Part of us is a big pediatric health system. The part that I oversee or started was our population health efforts, and now I oversee our national efforts, which is all focused on spreading and scaling what works. So we were very intentional about this session, that just as Chris has talked about, it's going to be interactive. And so the first 25 minutes, we'll hear from our speakers who I'll introduce in a moment. And then the next 30 minutes will be all about a discussion. And so here's where I'm asking each of you in the audience and online to think about your questions, because you'll have at least 30 minutes to raise these questions, and we will engage in a dialogue. So think about your questions. And I guess the other thing that I wanted to mention, because I think both Pamela and Chris did such a nice job of the intro, what we're specifically trying to do in this session is think about what we can learn from these other sectors. And there's going to be 4 examples from housing, neighborhoods, and environmental issues, and economic issues. And what we want to think about is how did they restructure the financing in a way that reallocated funds. And so if you pull out your agendas, it's really focused on this third objective, which is discuss the strategies, including conditions, needed to realign resources. That is, what does it take to move funding from one arena to another? And I want to challenge the polling results we had. The polling results really pointed to the desire for new, and I stress new, financing structures. And I want to challenge us. I don't know if they all have to be new. There's existing structures, and in fact, the examples really point to that. I'm sure we need a mix of things, but it just struck me that the poll was so much about new. And there's a tendency to focus on those shiny new objects like social impact bonds, right? But actually, what can we do in the current sectors, and what can we do with our current healthcare system? So that's what I'd like us to think about. And so let me then turn to introducing our great panelists. We have, and you have their bios, and so I'm going to give you a short, just a short intro. So Anthony Orlando is a doctoral student at the Sol Price School of Public Policy at the University of Southern California. And Raphael Bostic is professor and Judith and John Bedrosian Chair in the Governance and Public Enterprise Department, and he is the chair of the Department of Governance, Management, and Policy Process at the Sol Price School of Public Policy at the University of Southern California. And they've written a paper which will be finished soon, and that will be posted on the web page and will be sent to registered attendees. So with that, let me turn it over to our panelists. I've already given them a heads up that I'm going to monitor the time, 25 minutes for the both of them, because we want to leave time for the discussion. With that, please welcome our panelists.